What happens when you're in a rural emergency department and at 2 a.m. you have a few patients in the ER with abdominal pain and your CT scanner breaks? What do you do next? For me, that's a straightforward clinical decision. I know the different steps that I need to do depending on the hospital, depending on the other resources available. But one of the hardest things in rural emergency medicine, and one of my favorites, is what do you do in a low resource setting, and how do you grow in agility? And as physician leaders, how do we teach that agility to our team? Welcome to Medicine. I'm Dr. Othniel Doolittle. I'm the CMO for Integritas, and I work in a variety of rural emergency rooms. So when you have that patient that you planned on something, you had this set expectation that there was going to be a resource that you could utilize, and then it's gone. How do you respond? How do you develop that agility? It was years and years of practice for me where you're just thrown into that situation and the resource is gone and you just have to figure out what to do. I would make phone calls sometimes to colleagues and say, now what do I do? Or ask the nurses, has this happened before? What do I do next? As physician leaders, I want to empower you to be able to teach your team. Sometimes it's just reminding your critical access team, hey, these are the limitations to our resources. If you do lose a resource, this is what we do. And a lot of times when they've done it for years, they know what to expect. They know that sometimes there's no helicopter and you're stuck with an ICU patient for a couple days. Sometimes your CT scanner goes down. But your new grads or physicians who are highly skilled, but they've only worked in academic settings or busy ERs where they have a CT scanner all the time. They might have an MRI all the time, ultrasound all the time, a neurosurgeon all the time. How do we teach to our rural medicine colleagues what is it that we need to do as we grow in agility? It's a few simple things, but one is just knowing what those limitations are. Sometimes you spend so many years practicing that you have this expectation that's very different and maybe a little lower as far as the number of resources than some of your new colleagues coming on and a new grad coming out of residency in an academic center. So you being aware of what those limitations are is really important. And then informing. This happens for us during the interview process, saying, this is what this hospital has as far as resources. Here are your limitations. This is important to know. And then when you've provided that clarity to them, how do you make decisions in that low resource setting? What's your medical decision making, clinical decision making, guiding them through how you think through processes differently? Being an advocate, your team wants to know if you are fighting for them and for patients for better access to resources. There are some things that might seem a little bit cush and extra, like lots of different types of suture needles and material. A lot of times we're dealing with only like 5 different types of suture and a limited number of needles with those. And that's because those boxes are expensive, they expire. And when you're seeing under 10, under 20 patients per 24-hour period, those boxes will expire, and that's a resource that the hospital can't afford to lose. But explaining that to the team, when you communicate well about what you're trying to do to improve their situation, that helps them become more agile. And lastly, being available. Practicing all alone in a vacuum and 2 a.m. comes along and you're dealing with a difficult clinical situation and a paucity of resources. Who do you have to call? It should be your medical director, your chief medical officer, other physician leaders. My phone's always on. I'm ready to take those calls for my team, and they know it. And they do call sometimes. and say, what do I do in this situation? Every year there's a new weird situation. And when you're practicing alone, those doctors need you as a physician leader to be there for them because they don't have other resources and they need someone to bounce ideas off of. So whether you're reminding your current team or you're onboarding somebody that's not seen the wonders and excitement and adventures of rural emergency medicine, just know what your limitations are, what those low resources are, inform them, be an advocate, clarify how you make medical decision making, how you make medical decisions and clinical decisions in that difficult situation, and be available. Be ready to take their calls, to talk them through difficult situations. I'm Dr. Othniel Doolittle. Welcome to medicine. If this was helpful, like and subscribe. Feel free to send in comments, questions. I'm here to answer. Thank you.